Hello, everyone, and thank you for joining today's webinar. I wanted to just let you know we'll be getting started soon at the top of the hour. Thanks again for joining us. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing, Sigma, is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. No one in control of the content today have any relevant financial relationships with ineligible companies. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository in approximately 1 week. Following the presentation, if we have time, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so that the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. This webinar is proudly sponsored by InterStaff, Leading with Care. Please view this brief video from our sponsor.
InterStaff is an international nurse staffing agency focused on a nurse-first approach. Since 1998, we've used our decades of experience in evidence-based support programs to deliver impactful results for hospitals and the patients they serve. We recruit skilled nurses from over 50 countries, all eager to practice in the U.S. As one of the longest-standing agencies, we efficiently manage immigration, licensure, and relocation processes, making it seamless for hospitals. Long-term nurse success is at our core. Our holistic support and customized onboarding ensure smooth transitions, enhancing nurse retention and successful integration into hospital teams. In today's nursing shortage, InterStaff's international nurses provide a stable, cost-effective staffing solution, reducing reliance on domestic travelers while meeting both short and long-term staffing needs. We help hospitals build a sustainable workforce by attracting experienced nurses from across the globe. We're passionate about international nursing, leading with care, changing lives, and helping hospitals thrive. For more information, follow us on social media or visit us at www.interstaffinc.com. InterStaff is an InterStaff.
We would like to thank our speaker for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our presenter today is Pam Bradshaw. Dr. Pam Bradshaw began her nursing career over 30 years ago, working in many different areas of acute care. She has served in a chief nursing officer role across multiple organizations. Dr. Bradshaw joined the Shannon team in 2015, and she currently serves as the chief operating officer. Dr. Bradshaw received her Doctor of Nursing practice from Texas Tech University and maintains certification in critical care nursing and advanced nursing administration. She is also a fellow with AONL. Welcome, Dr. Bradshaw.
Thank you so much, and hello, everyone. It's truly an honor to be able to present our information with you today. I hope that you enjoy what we're going to share, and we'll be able to take some things away that you can use in your organization as well. So as we get started, assuming my slide will work. Next slide. As we get started, I wanted to share the learning outcomes that I hope you will take from this presentation. You should be able to develop a plan to successfully recruit and integrate internationally educated nurses in your organization, and also be able to construct a retention plan for those internationally educated nurses. Next slide. There we go. So I want to spend just a couple minutes telling you about my organization, and the reason that it is so important is because we are in West Texas, and I've seen many of you posting that you're below freezing. I think we might have made it to freezing by now, but it's very cold here too, and we're not used to that in Texas. So we're a very large organization. Next slide. And this graphic just demonstrates us. Now, this is our 2023 data. We have not updated for 2024 yet. But you can see, if you look at the state of Texas, all those little squares on there, we cover about 10% of the state in our service area. We only have about 300,000 people, so probably more sheep and goats than we do people. But it's a large area. And in order to do that, we really have to be able to staff. And you can see some of our statistics here. Next slide. Here's just a call out. And everywhere that you see one of those little shamrocks, that is where we have a clinic. So you can see we go all the way from the Mexico border up to above I-20. So very large. That total drive is probably about 4.5 hours to travel all of that distance and provide care for those patients. Next slide. Everything we do is focused on our mission, our vision, our pillars, and our values. And so you can see here our mission is to provide exceptional care for our family, friends, and neighbors. And our vision is to be trusted. We know trust has to be earned, so that is extremely important for us. And I believe that that comes into my presentation later as well, because if you don't have trust with those you're working with, you're not going to be successful. Next slide, please. We're also very excited that we are part of the Mayo Clinic Care Network. We are actually the only system in the state of Texas that is part of this. And what that brings to us is a collaboration with Mayo Clinic that benefits not only our community and our staff, but our patients. Next slide. We're also a Leapfrog A organization. Next slide. And we received multiple recognition for the care that we provide for our cardiac patients. As you can see here, these are the highest levels of achievement available to us. Next slide. We're a pretty large organization, and this slide you can see over about a 3-year period, we grew for over 1,000 employees. And there's multiple reasons for that, but primarily a lot of that is nursing. We built a new tower. We acquired 2 other organizations in our region, and having nurses to support those patients is extremely important. Next slide. You might think, well, do they have a turnover problem? And so I thought I would share this. Really, we don't. So this is our voluntary turnover. These are people that choose to leave our organization and work somewhere else. And we would have preferred that they stay. So our definition is just like everybody else. You can see here, 2022 was not a good year for us, right there in the middle of COVID. And we really focused on getting our staffing back to where it needed to be. But we're proud to currently be at around 13.2% for our organizational turnover. Next slide. You might also wonder, how did we get nurses? Well, we call it long-term contract labor, and these are really our international nurses that have joined our team. You can see, again, that same 3-year time period, we grew almost 3 times. So in 2021, we had 58 that were on contract in our organization. And as of the end of 2024, we were at about 140 nurses that were on contract with us. Next slide. So why does this matter? If you look across the United States, you can see, we've all heard the nursing shortage, and we know that it's coming, and what are we going to do about it? And some of these states, if you're in a green state, you're doing great. Your nursing shortage is not going to be too significant. But if the darker your color, so Georgia, if you're in Georgia, you're probably going to struggle getting nurses. In Texas, where I'm at, it's expected to be at about 10%. And you can see just across the states, there's a lot of different levels of the shortage that are going to impact us. And this is predicted for 2036, which will be here before we know it. Next slide. Of course, this is a Sigma presentation, so you have to have your research to back it up. So this is from AACN Nursing, and this supports the data that we just saw. So between now and 2032, there's the nursing shortage just continuing to grow by about 200,000 nurses. Each year, there's just under 200,000 nurse positions that open up every year due to retirements or nursing workforce. And then about 23% of the nurses that work in outpatient or ambulatory and clinical settings plan to retire in the next 5 years. In the hospital setting, which is where most international nurses would come into play, we have less nurses that plan to retire, but they have lowest job satisfaction just based on the work that they do. So it's not easy to work in any of these settings. Next slide. Continuing to look at that, when you look at the Bureau of Labor Statistics, it supports that additional information we saw just a minute ago. And nurses are growing at a faster rate, 6%, than any of the other occupations over the next 10 years. And again, reinforcing that about 200,000 positions will open up each year on average over the next decade. Next slide. So why? What is causing this? The aging population is surely a factor. In the United States alone, we have more Americans that are over the age of 65 than at any other time. And within the next 5 years, the last of the baby boomers will reach retirement age, which further increases those people that will be retiring and need additional health care. On top of that, the workforce is aging. Of course, our workforce is part of that aging population. And right now, again, in the United States, 1 million nurses are over 50 years of age, meaning that in the next 10 to 15 years, about a third of that workforce is going to retire. We are struggling to replace those nurses. Faculty is a problem for us. We know that. Every year we turn nurses away. One of the things we track in Texas are the number of nurses that are turned away from the schools, and it's quite alarming. And it's because there's just no capacity in the schools, even though these people are qualified. And we've got to figure out a better way to deal with that. Next slide. So again, just another graphic that shows our average age, and I'm a little bit above that. So the average age right now of our registered nurses is almost 48 years of age. 56% are over the age of 45, and 1 million nurses will retire by 2030. Next slide. So what are we going to do about it? Next slide. We have to think outside. I said the lines, but the reason I said the lines is because for us in the United States, the lines are our borders. So we have to think outside our traditional borders and really consider internationally educated nurses as an option. There's things that you have to consider working on that. It takes time. It can take years to recruit a nurse from outside the United States. It's a very complicated immigration process. And, unfortunately, politics has played a role in that over the past several years. It is very hard on the nurses that are trying to migrate to the US, and it's hard on the organizations that are trying to recruit them. And often you do face unexpected delays. So it's a bit of an unknown when you're working through this process. It absolutely requires innovation, patience, and diligence. But I also want to point out this will not solve the nursing shortage. It is just one piece of a puzzle that can help us to continue to improve nursing availability within the United States, while also considering the impact on the countries that these nurses are coming from. Next slide. So where do we go from here? You've got to build relationships. If you are interested in international nursing, you need to find an organization that aligns with your organization's health system values. So I put our values and our mission and vision up here again, because it comes back to that trust. If you don't have a trusting relationship with the partner that you find, you're not likely to be successful. And so I encourage you to talk to many different organizations. There's different ways that you can recruit. You can do direct hire, you can do contracted services, but you've got to find what works best for your organization and have a partner that will help you do that. In other words, don't look for a vendor, look for a partner. You want someone that's going to deliver on what you agree to. So check some resources, call your friends that might use those organizations that you're looking at. You want somebody that's going to support the nurse, and they need to support them from the beginning all the way to the end. You want an organization that's going to collaborate with the frontline nurse leader in your organization, because it can be challenging. You have a partner that isn't in your organization, not in your city most often, and you have to figure out how do you support that nurse from the organizational perspective, so your organization, as well as the person that typically is their, I'll use the word boss, their employer, who is the contracting agency. We need to provide routine updates. You've got to have that open line of communication, both from your partner to the organization and the organization back to the partner. And you've got to help facilitate the transition. So when that nurse comes to your organization, they're in literally a whole new world, a whole new country for them. So how do you support them in partnership with their agency? And again, at the end of the contract, because the ultimate goal is to convert the nurse to work permanently at your organization. Next slide. So let's talk a little bit about onboarding. This picture here is actually one of our international nurses that came to us and has stayed with us for many years. So you've got to make sure that you're setting the nurse up for success. You want to understand and acknowledge the difference in practice settings. I'll give you some examples. When nurses come to work for us, they're typically not familiar with telemetry monitoring or with the IV equipment that we use. In some countries, the nurses do not even start the IV, so we have to train them to be able to do that. And it's important to understand what the nurses are comfortable with and where they need help. You need to be flexible on the most appropriate work setting. So another example, we had a nurse who came to us as an OR nurse. She had several years of experience as an OR nurse in her home country. But when she arrived in our organization, we're a much bigger organization, a trauma center, and she really felt like she was not delivering the level of care that she wanted to be able to do that. So we supported her transitioning into a PACU nurse role. So she made that very smooth transition and has stayed with us for a long time and been successful in that role. At some point, she might want to move back to the OR, and if so, we'll work with her to help that transition. Another great example, we hire many nurses who are interested in working in ICU or critical care. Usually we will start them on our step-down unit, our telemetry unit, and then work with them to really build up their skills, because critical care for us is different than the critical care that they're accustomed to. But typically within about a year, 18 months, they're ready to make that transition to the ICU, and we support them. It allows them personal growth, and we also, it helps us ultimately retain them because they're working where they want to work versus where they came just because they wanted to come into the US for a job. And then finally, you need to personalize their orientation. In our organization, we actually offer an extended orientation for nurses that have not previously worked in the US. Often they're on orientation for 12 to 16 weeks, and that helps them be successful and make sure that they are safe to provide that exceptional care for our patients. But I think the most important thing to consider is their preceptor. So when you are matching that new nurse, just like you would for any other nurse that you have, how do you find somebody that can be a great preceptor for them? In the ideal world, perhaps you have a preceptor who is also an international nurse, maybe has been with your organization for a while, willing to serve as that preceptor. And it could be even better if they're from their same home country. So, for example, we have several nurses that come to us from the Philippines. If we can find a nurse that is part of our organization that is willing to do it, we match them up. It helps them both while they're at work and outside of work because they're able to build relationships with the people around them that truly understand what they have been through and what it's going to take for them to be able to succeed. Next slide. I feel like it's very important to re-recruit our team members. We believe in treating our internationally educated nurses just like we would any other team member. We need to treat them with respect. We need to remind the nurse and our team why they chose to join our Shannon team. And we need to support their professional growth, which I've already talked about ways that we do that. Some of the other things that we do is we provide ongoing education at no cost to the nurses. So that might be basic CPR, it might be ACLS, TNCC, PALS, whatever it might be, we provide them at no cost for these team members that are on our team. We also need to be working towards transitioning to employment with our organization early on. So even though they won't have our benefits at the time, we need to talk about it. So what does our health plan look like? What does our dental? How do we earn PTO? And make sure that they understand that once they transition to our team, they will be eligible for all of those same benefits, just like any other team member we have. Next slide. Most importantly, treat international nurses just like you do every other nurse. If you have incentives, for example, we do shift incentives if you work nights, if you work weekends. During COVID, we had all sorts of incentives. It was pretty crazy what we did. But we made sure that every nurse that worked for us, whether they worked directly for us or that they were contract for us, they were eligible for the same incentives that our current team members are. They get the same bonus. Every year we do $100 Christmas cash for our team members. Our international nurses get that too. For Nurses Week, they get the same gifts that our team gets. And then, of course, we need to offer that same support from their frontline leader, making sure that we're checking in. Do they have the tools and resources they need in order to be successful and work with them? So this is another one of our international nurses. You can see there's a lot of equipment behind her. This is Holly, and she's been with us about 8 years. She actually was just promoted to our OR educator. So that was her passion, and she does an exceptional job with that. And we're very thrilled to have her as part of our team. Next slide, please. So how do you retain these nurses? You have to start at the time of hire. You have to maintain consistent touch points, again, with the agency that employs the nurse, the manager, and the nurse together. Talk about that you want the nurse to join your team. Talk about it early and talk about it often. And about 45 to 60 days out from their contract end, get an offer in front of them. They want to know, just like any other person, am I going to have a job? How am I going to support my family? How am I going to be part of this community? Do you want me to stay? So we need to let them know, yes, we want you to be part of our team and how we can support you by doing that. Next slide. So what's our recipe for success? You also have to understand the nurse's goals. And I think that's probably the most important thing that I would want you to take away from this. Most of our nurses have family, and I used quotations, back home, because back home can be multiple locations. Sometimes it's halfway around the world. And the nurses are here away from their family and not only dealing with new job, new country, but also dealing with being separated from their family. So how do we support them? Income is important. These nurses are often willing to work extra because, again, they're supporting their family and they need to be able to do that in a way that allows their family to maintain their standard of living as well while supporting the nurse while they're here. They want to be part of the team. So if you celebrate birthdays, anniversaries, whatever it is, include these nurses in part of that celebration. One of the lessons we learned early on is when our nurses first came to us, when we first started doing international nurses, their badge looked a little bit different. It had a yellow stripe across the bottom, and it said contract nurse or contract, something about the word contract. Well, some of the feedback we got was, that makes us feel like we're not really part of the team. We're just here as a contract, and that's saying to me that you don't think I'm important. So that was an easy fix. We changed our badges, and now our badges look like everybody else, and that was based on feedback that we got from some of our team. Next slide. The nurses also want to be welcomed by the community. So how can we as an organization help set them up for success? Is there a church that we know that, I'll use the example of our Filipino nurses. We have one of our volunteers that's been a volunteer for us for probably 50 years. She is passionate about supporting these nurses. She invites them. There is a church that has many Filipino members as part of that church. She reaches out to every one of these nurses and invites them to come to church with her. And I think that that makes a huge difference, and it allows these nurses to connect with their peers, both at work and outside of work. How do we connect for social events? Is there something we need to make sure we're educating and including them in? If they have children, how do we connect them with the schools? How do we get their kids in sports if that's what we want to do? Being the largest employer in our community, we have a lot of connections and we have a lot of ways to be able to support these nurses and make them feel like they're welcome and truly become part of our community. Next slide. We also need to share the why. It's very important that we educate the nurse leaders that are working with these nurses on the differences and how they need to think a little bit differently when they're working with the staff. So they need to understand cultural difference. And I will point out it varies by the native country. We have nurses literally from all over the world that work for us. And you have to always be thinking about how it's different based on where these nurses are from. Again, integrate the staff. The nurse leaders have to integrate the staff. They have to treat them like their own staff, not like a contractor. We also have to educate everybody else in the organization because if you see people walking down the hall, you want to speak to them. You want to be nice to them, which is no different than anybody else. But they might wonder, why are these nurses here? Why aren't we hiring nurses that are here locally? So we have to educate them and let them know we hire every nurse we can that's from our community. But if we aren't able to hire them, our commitment is still to take care of our patients. So how are we going to do that? Got to think differently. Got to bring in people from outside our community because our community is not growing. So how do we make that difference? And then how do we educate the community? How do we provide that support for the spouses and children, as I've already mentioned? So sometimes I will go and I'll speak to the Rotary Club or any of the other community organizations, and it really helps them understand why we're doing what we're doing and help them help our nurses integrate into this community. Next slide. So the results, you want the nurse to complete their assignment because it benefits the nurse. They have guaranteed income over their contract period. They have that stability, and our goal is that they have a great working environment. That's very important to us. But it also benefits the organization because if they complete their contract, that means that they have worked for us typically for 3 years now. So they're loyal team members. And we're able to convert those nurses with no additional orientation required. And now they're experienced not only with the experience they had prior to joining our team, but the experience that they've had while working as part of our team. And it really does help with that consistency for our patients and our team because they know us and we know them, and we want them to stay as part of our team. Next slide. So I'm very proud of this statistic. And this is based on some of the international information that's out there. For most organizations, the contract completion rate varies between 75 and 90%. And I'm thrilled to say that here at Shannon, and you saw our numbers, we currently have 140 that are on contract with us. Historically, 95% of our people that have come to join our team have converted and stayed as part of our team. They've completed their contract and then they stay and be part of our organization. Next slide, please. So there's my references. Next slide. So thank you. Here's my contact information. I've got my email. It doesn't have to be in all caps, but I couldn't figure out how to change the template, so sorry about that. And then my phone number is listed as well. I'm happy to answer any questions that you might have for me.
Thanks, Dr. Bradshaw. We did have a few come in. The first question that came in was, are your facilities magnet designated, and how does this impact your internationally educated nurses?
Thank you for that question. Great question. We are not a magnet designated facility. We are a community health system, and we've talked about it, but the reality is we don't have a lot of the resources in our community that we would need. For example, the nurse scientist and that sort of thing. However, we are on the Pathway to Excellence designation. There's a little bit different requirement there. And we are a CIHQ nurse-friendly organization. I'm sorry, I can't think of the exact title of it right now. But essentially what that means is that, so CIHQ is our accrediting body, much like Joint Commission or DNV and other organizations. And with that designation, it shows that we are dedicated to our nursing staff. It is many of the same requirements that you would have for Pathway or Magnet as far as the environment that you have. And because of that, we actually have very low turnover for our nursing. We're below national and state levels for voluntary turnover for nursing staff.
Great, thank you. Next question. How does employment look like for seniors or nurses with master's and doctoral studies? Do they also start from a fresher level or do they get a higher level? And then a follow-up to that, is there anything for nurses from community health nursing experience?
You may have to repeat some of those for me. So let me see if I got all of it. If we have nurses that come to us that have an advanced degree, we have a differential that we pay for those nurses. So we pay a differential for bachelor's, master's, and then doctorally prepared. So, different roles. Of course, if you're in a leadership role, we would prefer that you have a master's degree. As I mentioned Holly earlier, she has her master's degree and she is one of our educators in our organization now. Tell me the second part.
The second part was, is there anything for nurses from community health nursing experience?
So for community health, we have a home health program. So I'm not sure if that's exactly what you mean by a community health, but we do have a couple of international nurses that work in our home health program. We also have what we call care coordination, which are nurses that work with patients that might need more ongoing contact, transition of care. Maybe they come into the hospital frequently, so they get more frequent touch points based on their specific diagnosis, such as diabetes, heart failure, than you would get through home health. And typically those nurses have a little bit higher degree and work more closely with those patients. So yes, we have pretty much every service line that you could have in our organization.
Thank you. Next question. Is there research on the impact of recruiting nurses from various countries and what it means for the health infrastructure of those countries? wondering how it is beneficial, more nurses than there are positions available and or harmful.
Great question. Yes, I know there's research out there. I did not pull any of that into my presentation. I am aware that there's a lot of discussion about how recruiting to the US negatively impacts the countries that those nurses are coming from because, they have patients too. They need help as well. One of the things that I have found, I've been working with international nurses for about 10 years now. And one of the things that I have found is that there are actually some programs that train nurses specifically to come to the United States. And I am sure that that has a negative impact on their country, but unfortunately, I don't have that information in front of me.
Sure, thank you. These next two questions are related to, and I'll split them up, but they're related to sort of mission and values alignment. So the first one is, in addition to alignment of values and mission, what would you suggest looking for when choosing an international vendor partner?
That's a great question. I would say you really need to understand what they offer the nurse because some of the lessons learned in the years that I've been doing this is that sometimes agencies are not fully transparent with the organization, so our organization. And we learned, we had a couple nurses that were going to break their contract. And what we learned was that the agency, even though we believed that the nurses were receiving the same shift differentials or, the differentials for being the charge nurse or the preceptor, those nurses actually were not. And the nurses felt like it was us, the organization, treating them differently. And when we found that out, we went to the agency and we said, that's not acceptable. That is not what we believe in. That doesn't support the message we're trying to deliver to our team. And you need to fix this. And if you don't, we're going to no longer partner with you. So I think transparency is key. You need to ask every possible detailed question and understand how that nurse is being compensated, because every time we've had a problem, that is really where the problem has been. We believed one thing, and the reality is the nurses were not receiving that same thing that we thought they were. So do your due diligence, check with people that use them. And I would ask them if when I'm looking for a partner, I ask them for people that have worked with them and chose to stay with them and people that have chose to leave. And sometimes they won't share that, but that also shares information.
Sure. Yeah, that would be telling for sure. So one of our attendees wrote and thanked you essentially for sharing some incredible best practices. The question they posed is, how do you make sure your frontline nurse leaders are all on board with your philosophy and are supporting international nurses consistently across departments?
Great question. When we first started international recruitment, our first partner actually came in and helped us do a lot of education for our nurse leaders. And we are fortunate that we have very little turnover in our nursing leadership, the frontline leadership. And when we do have turnover, often they've been promoted to the next level up. So, which really isn't turnover, it's a promotion. So we work very closely with them. We have routine meetings with our nurse leaders, and this is often something that's on our agenda. We ask how it's going. Our nursing directors, so the level above the frontline nurse leader, it's one of the things that they closely monitor as well. And we talk to the nurses. We ask them how it's going. We ask the not only the nurse, but the other team members that are working with them. And it's just that ongoing focus. You've got to stay on top of it, and you've always got to remind. And if we hear something, like if our partner comes back to us and says, our nurse told us this, then we deal with it and we address it. I will say we had one nursing unit that had a lot of international nurses that were part of that unit. And we were having some challenges with the leader. And ultimately, we ended up making a change, which was positive for not only our international nurses that are up there, but for the rest of the team as well. And now that unit has done a 360 turn and is one of our highest recruiting and productive units. So you've got to keep your finger on the pulse of what's going on and always talk to your nurse leaders.
Our next question is, have you faced resistance with bringing in internationally educated nurses? If so, how was this addressed, and how do you mitigate biases that might exist?
Interestingly enough, like any time there's change, you're always going to have challenges. And when we first started bringing in international nurses, we got some resistance from some of our physicians. One of the challenges that our international nurses face is English is often not their first language. And sometimes I grew up in Mississippi and I struggled with an accent for a long time. And people would, sometimes say, "What did you say? I don't understand you." Well, it's no different when you're dealing with someone that's coming from another country. Sometimes they have a hard time understanding us, and we have a hard time understanding them. So we worked with our local community college. They have an English as a second language program, and we support any team members that want to participate in that. We also, if we see someone who's really struggling or that we believe could benefit from this program, we support getting them in there and really helping them to grow in that as well. And really, the way we combated that was we would work with that team member. If they were having a challenge, we would encourage them to go, for example, if they needed to call a physician, we would encourage them to work with their charge nurse and really help them make that call. So we ensured that they had that support. Over the years, since it's gotten, we're so far down the road now, occasionally we'll hear a concern. Sometimes a patient will say something, and we just let them know that, these are one of our team members, and we expect that you treat them with the same level of respect that you would any other nurse or any other team member that we have. And we remove, if it's a patient situation and the patient's behaving inappropriately, we will actually change the assignment for that nurse because we don't want them to have to face dealing with those negativity and biases that we can prevent. We can't prevent everything, but we can absolutely address it when we know about it, and we do.
Well, you've started at least addressing the next question, and actually the final question we've received in the already. So is there anything to expand on related to any resistance from patients? The person specifically wrote in any language barriers, but is there anything you're able to expand on related to that sort of patient experience and any resistance that you've seen from them with internationally educated nurses?
I guess the only thing that I would add is um, sometimes we do have to make those changes. In the years that I've been doing this, we've probably recruited, I would say, between 250 and 300 international nurses. And in all that time, there's really only been, I can think of two, that the language barrier was so significant that we had to do something different with that nurse. She actually they actually ended up not working for us because we could not overcome that barrier. But it's pretty rare that I get a complaint from a patient. And often, one of the things I'm most proud of, we we have what we call the DAISY Award in our organization. And many of you are probably aware of that. It's an international nursing recognition program. We have given DAISY Awards to our international nurses because of the work and the compliment that we get from our patients. So yes, times you have patients that complain, but so much more often the patients really love our international nurses, and we just deal with those one-off situations as best as we can.
Well, Dr. Bradshaw, I want to thank you again for all of your time today and for sharing this great information. Sigma is grateful that you took the time to share with this audience and we look forward to hearing more from you in the future. To our attendees, we hope you enjoyed this webinar. We have updated our process as indicated in the chat so that webinar attendees can now access our learning management system to complete the evaluation and obtain your certificate right after the webinar concludes. Please note that you'll not be able to click the link that is on the screen. However, we have shared the link in the chat for you. If you cannot access the link, you can access the evaluation through Sigma's Learning Management System by searching the title of the webinar. In addition, all attendees will also still receive an email within a week of this webinar, as well as with the link to access the evaluation. This is the third webinar in the Navigating International Nursing Staffing webinar series, sponsored by InterStaff in conjunction with Sigma's upcoming Creating Healthy Work Environments event. Registration remains open for the event. You can scan the QR code on the screen to learn more. Thank you again.
Thank you, everyone.
Thank you, Dr. Bradshaw, and have a wonderful day.